Have you ever watched someone over 65 seem to age and fast forward, more tired, more forgetful, moving slower, almost overnight? We often blame just getting old, but sometimes the real culprit sits in a plastic bottle in the kitchen drawer. After 65, your body processes drugs differently. You have less muscle, more fat, and slower liver and kidney clearance. That means some common medicines can quietly drain your energy, stiffen your joints, dull your memory, and raise your fall risk. Before we start, this is education, not personal medical advice. Never stop any medication suddenly. Instead, use this guide for a safer, smarter conversation with your clinician. Tools like the American Geriatric Society's Beers criteria help doctors spot riskier drugs for older adults. 1. Sleeping pills, Benzodiazepines, and Z-drugs. Why they can age you faster. Medicines like diazepam, lorazepam, temazepam, and Z-drugs, such as zolpidem, can fragment deep sleep, slow reaction time, and impair memory. In older adults, they're strongly linked with confusion, falls, fractures, and car crashes. Even low doses can linger longer in the body after 65. The AGS Beers criteria recommends avoiding them for insomnia in most older adults because safer options exist. health.yukon.edu. Margaret's story. At 70, Margaret from Yorkshire started a small dose after her husband passed. The first week, she slept. By month 3, mornings felt heavy. She shuffled to the bathroom, lost her balance on the stairs, and began forgetting appointments. Her doctor reviewed her list and planned a slow taper, switching to non-drug sleep strategies. Within weeks, her alertness and steadiness improved. What to ask your doctor? Can I try CBTI, the gold standard non-drug treatment for chronic insomnia? It's first line in adults and works better long-term than pills. acpjournals.org+1. If I'm already on a sleeping pill, what's a safe taper schedule? Stopping suddenly can cause rebound insomnia and anxiety. Could we use short-term, lowest effective doses only and avoid mixing with opioids or alcohol? Gentle alternatives to discuss: cognitive behavioral therapy for insomnia, CBTI, a consistent sleep-wake schedule, light morning activity, and addressing pain, reflux, or nighttime bathroom trips that wake you. PMC2. Anticholinergics, Allergy, Bladder, and some mood medicines. Why they can age you faster. Anticholinergic drugs block acetylcholine, a key brain chemical for memory and attention. Common culprits include first-generation antihistamines, like diphenhydramine cetcobenadryl, bladder drugs, oxybutynin, tolterodine, and older antidepressants, amitriptyline. In older adults, a higher cumulative anticholinergic burden is linked with confusion, constipation, dry mouth, urinary retention, and a higher risk of dementia over time. JAMA Network +2, PMC +2. John's story: John, 75, took oxybutynin for bladder urgency and a nighttime PM allergy pill. Months later, he felt foggy and misplaced bills. His daughter worried it was early dementia. The pharmacist recognized a high anticholinergic load. John's clinician switched him to non-anticholinergic options and bladder training. Within 6 weeks, his clarity improved. What to ask your doctor? Could my allergy or bladder medicine be anticholinergic? Can we switch? For allergies, non-drowsy antihistamines like cetirizine or loratadine may be safer. Options like mirabegron or pelvic floor therapy may help with bladder. Can we review all my prescriptions and OTC/PM products for hidden anticholinergics? How do we track my anticholinergic burden over time? Tip: bring every pill bottle, prescriptions, over-the-counter meds, and supplements to a single brown bag review with your clinician or pharmacist. It's a proven first step in deprescribing. PMC 3. Heartburn pills. Used long-term, proton pump inhibitors, or PPIs. They can aid you faster when used for months to years. PPIs, omeprazole, esomeprazole, lansoprazole, powerfully reduce stomach acid. Great for ulcers and severe reflux, but long-term continuous use can lower magnesium and vitamin B12 and is associated with higher fracture risk in some studies, especially at higher doses and over a year or more. Low magnesium can trigger muscle weakness and abnormal heart rhythms. Low B12 can sap energy and cloud thinking. Gastroenterology experts advise reviewing the need regularly and stepping down when appropriate. meridianbioscience.com +5, U.S. Food and Drug Administration +5, U.S. Food and Drug Administration +5. Nora's story. At 68, Nora loved spicy food. Daily PPIs kept her comfortable, so she stayed on them for years. Then came fatigue and a wrist fracture from a minor fall. Her clinician checked labs. Low magnesium and borderline B12. With diet changes, weight loss, elevating the head of her bed, and stepping down to the lowest effective dose with occasional H2 blocker rescue, she kept symptoms controlled and rebuilt strength with calcium, vitamin D, and walking. What to ask your doctor? Do I still need a daily PPI, or can we step down? Should we check my magnesium and B12? Can lifestyle changes or intermittent therapy control my reflux, e.g., smaller evening meals, avoiding trigger foods, weight reduction, sleeping on the left side? PubMed. 4. Long-term corticosteroids, Prednisone and similar. Why they can aid you faster. Steroids are life-saving for flares of asthma, autoimmune disease, and severe inflammation. But months of use can thin skin, weaken muscles, raise blood sugar and blood pressure, disturb sleep, and, most importantly, strip calcium from bones, sharply increasing fracture risk. Up to 40% of long-term users develop osteoporosis without prevention. The goal is always the lowest effective dose for the shortest time, plus bone protection if used beyond a few weeks. NCBI +2, PMC +2. Helen's story. At 72, Helen's hands ached from inflammatory arthritis. A temporary steroid became a daily crutch. After a year, she had a rounded face, thin skin, and a minor spine fracture. Her rheumatologist built a steroid-sparing plan, disease-modifying therapy, strength training, vitamin D and calcium, and a bisphosphonate for bones. They created a slow taper to protect her adrenal glands. Within months, her posture and energy improved. What to ask your doctor? Is there a steroid-sparing plan for my condition? If I need steroids longer than a few weeks, how do we protect my bones? What's the safest taper for me? Stopping abruptly can be dangerous after long-term use. 5. Certain blood pressure medicines in excess, especially high-dose beta blockers without a clear ongoing indication. Why they can age you faster when overused. Blood pressure control is crucial for longevity, but overtreatment, especially with higher-dose beta blockers, can slow the heart too much, leaving you exhausted, lightheaded, and intolerant of activity. Fatigue, cold hands and feet, and sleep disturbances are recognized side effects. Evidence that beta blockers directly cause depression is mixed. Large analyses don't consistently support a causal link. The key is fit, the right drug, dose, and reason. Sam's story. At 74, Sam took a beta blocker after a heart scare years ago. His blood pressure looked perfect, but he felt decades older. Slow walks, midday naps, no interest in gardening. A review showed he no longer had a strong reason for a high dose. With his cardiologist, he carefully reduced to the lowest effective dose and added walking and light resistance training. Within weeks, his pace and mood lifted. What to ask your doctor? Do I still need this beta blocker and at this dose? Could fatigue or dizziness be low heart rate or blood pressure? Are there alternatives that fit my heart history better? Your team may consider other first-line options or combination therapy. Red flag combinations that quietly steal strength. Sedatives plus opioids increase the risk of severe sedation, falls, and breathing problems, especially dangerous in older adults. Keep your team informed if more than one prescriber is involved. health.yukon.edu. Multiple anticholinergics at once, for sleep, allergies, bladder, can add up to big brain fog. Ask to simplify. JAMA Network. 5-question medication review. Use this at your next visit. What is each medicine for, and is it still needed? Is this the lowest effective dose for someone my age and kidneys? Could any drug be causing my symptoms? Fatigue, falls, foggy memory, constipation? Can we try non-drug strategies or safer alternatives first? The safest way to taper and monitor? If we reduce or stop something. Regular brown bag reviews, bringing all RX and OTC items to one appointment, help catch duplications, drug-drug interactions, and hidden high-risk meds. PMC +1. Aging is natural. Accelerating it with the wrong medicines is not. If you're 65 or older, you deserve a regimen that protects your brain, bones, balance, and joy. Look at your list tonight. Circle anything for sleep, allergies, bladder, reflux, or high blood pressure that might fit our discussion. Book a conversation, not a confrontation, with your clinician or pharmacist. Ask the 5 questions. Request a slow, safe plan if changes are appropriate. Before you go, tell us in the comments, which medicine surprised you the most, and what question will you ask your doctor this week? If this helped, please like, subscribe, and share this video so more families can protect their energy, memory, and independence. One safer prescription at a time.